Hello everybody, today I'm going to be speaking to you about preprints and peer review, incorporating some feedback from the International Society of Medical Publication Professionals meeting in 2018, and also offering a publisher's perspective on these topics. My name's Yianni and I'm a publisher at Taylor & Francis. So peer review. So the peer review process is where academics working in fields similar to the paper submitted independently assess articles and provide constructive feedback on the accuracy of the article and its suitability for publication in a journal. Now, peer review is completely crucial to what we do in publishing, and it ensures that academic research published in journals is accurate, balanced and complete. It's fundamental to what we do as publishers. So we often get the question of why do academics give up their time to peer review articles? It's a time-consuming process for them. So academics do this generally because they're interested in the field and they want to read the latest research that's going on in the field, and also they have an invested interest in making sure that what is published is accurate and complete. It's also a reciprocal process, so they know that one day they're going to publish an article and they're going to need someone to peer review that for them. And however, we are finding it increasingly difficult to find peer reviewers to publish articles in a timely, to peer review articles in a timely manner. And this is just because of the additional pressure on academics. Everyone's getting busier and busier. And also there is an increased output of papers going through peer review. So it makes things a little bit difficult. From a publisher's perspective, we are finding things more and more difficult when it comes to peer reviewing papers in a timely way. The process is time-consuming, it's expensive, but we know that it is absolutely crucial to everything we do. So we really do need to get it right. And there's a lot of new models of peer review emerging from different publishers, and I'm going to talk through those in a later slide. We also do more and more around incentives, reviewer credit and reviewer training to improve the peer review process. So incentives for peer review can range from anything from waivers on APC charges for open access to crediting the peer reviewers in the journal to actually paying peer reviewers for an expedited peer review process. And at Taylor & Francis, we also publish with an organisation called Doubleblind, which is an online platform that helps reviewers get verification and recognition for their work, and a lot of other publishers also work with this organisation. Another thing that we're doing at the moment in Taylor & Francis is we're part of a trial looking into blockchain in peer review, which is quite an interesting initiative, so watch this space for more information on that. So I'm now just going to briefly talk through some of the different models of peer review that are out there, and these are constantly evolving and becoming more and more widespread. So the first one is a standard double-blind peer review, and this is still completely the most common form of peer review used. In double-blind peer review, neither the identities of the reviewer and the author are blinded. So the pros of this are it's completely unbiased. Reviewers are they feel like they can speak freely, and the author is protected to a certain degree from criticism, certainly any criticism that would come from knowing who they are. Potential cons are there's no accountability for this, and that means that sometimes reviewers would speak in a way that maybe they wouldn't if they knew that they were being named on a paper. Anonymity is not guaranteed. I think it's sometimes quite easy to work out who the author is, and that's impossible for us to completely blind. And there is a school of thought that knowing the identity of an author might help inform a decision on a paper. Next one is single-blind peer review. So this is where the name of the author is known, but the reviewers are kept anonymous. And the pros of this are, as I mentioned before, that some people feel like the knowledge of who the author is and knowledge of their previous work can actually help in making a decision on a manuscript. The cons are that knowledge of the author may reduce scrutiny. So if it's a really big name in the field, the reviewer may feel that they just assume that the work will be as good as other papers. Discrimination is more likely, so on the flip side, they may have read previous work from this author and felt that it wasn't good, so have a bias there. And it also could be viewed as potentially unfair because the author's name is freely available, but the reviewer never gets named. Open peer review. So open peer review is where the author and the reviewer names are both freely available and known, and very often the reviewer names are published in the article as well, so everyone knows who's reviewed the manuscript. And some open peer review goes a step further than this, where the actual reviewer reports are published alongside the article, so people can read that alongside and see the criticisms and how they've been addressed in the final article. So the advantages of this are it encourages accountability, civility and quality, increases transparency and encourages constructive reviews. The reviewers are given clear credit for their part in improving papers, and this we tend to find more thoughtful, thorough reviews in an open peer review setting, especially where the reports are published alongside the article. Potential cons are sometimes the reviewers may feel that they cannot speak freely about an article. Again, it comes back to if it's that big name author, they may feel like they can't be critical because they want to work with them one day. And particularly for pharma-funded papers, they may feel like if they critique a paper openly, then it might reduce the possibility of getting funding from them in the future. We find as publishers it's harder to get reviewers to agree to review these, and that may be for those two reasons. And reviewers may take longer to submit. I guess they're thinking it through more, making sure that if their report's going to be published alongside the article, that all the sort of English language and all of that is completely correct, so it can take a bit longer. Collaborative peer review. So this is an interesting one and quite a new thing. It's not done by that many publishers, but this is where a group of peer reviewers have to agree on their decision on a manuscript. So they have to work together, collaborate, and give one unified decision on a paper. So the advantages of this is that it encourages scholarly debate, which is always a good thing, and it reduces the occurrence of wildly conflicting comments, which can be confusing to an author. Cons, it's very time consuming, it's difficult to manage, and you lose the potential benefit of having these independent evaluations so that the different reviewers aren't influencing each other. And there could be this groupthink outcome to this kind of peer review. Post-publication peer review, so this is where a paper is hosted before the peer review process, and experts are invited or indeed freely encouraged to comment on the paper post-publication. And some journals that do this allow for revision post-publication as well. And the advantage of this is it encourages an open discussion and debate, which is all completely open and free for anyone to read, whereas sometimes peer review is done sort of behind closed doors and people don't get to see that aspect of it. It allows experts who haven't specifically been invited to peer review a paper but are interested in it to offer their opinion and to provide peer review. And as I mentioned, it offers the opportunity for papers to be corrected or improved at a later date. Cons, there's the risk of publishing inaccurate information because it goes up before any peer review has been undertaken. Again, reviewers may feel they can't speak openly, and it does require careful curation to avoid the risk of people offering critiques that are not polite. Moving on to patient involvement in peer review. Again, this is not widely used at the moment, but this allows, as you would imagine, it allows patients to be involved in the peer review process and offer their opinion on how useful this paper is actually going to be in a real world setting and useful to them, which has very clear advantages. And it's also it's popular with authors because, a lot of the time that's what an author is wanting to do. They want to improve clinical practice, and this is a clear verification that the patient has found it useful, and they can provide advice on how to make it more useful to maybe a more of a lay audience. The cons are, as you can imagine, it's quite time consuming. It's difficult to source these reviewers. They're sometimes hard to find these patients, and even harder to get them to consent to reviewing. And it's really not well tested. I think it's only the BMJ who do this at the moment. As you can see, even more different types of peer review. There's lots out there. So Resultsfree peer review. So this is where the methodology is reviewed separate to the results section, and it reduces the selection bias towards publishing positive results. So the reviewers are asked just to comment initially just on the methodology and the soundness of that before later looking at the results. Cons are it can be quite time consuming because you have to go back to them again with a full paper, and it's only really relevant to sound science journals, but it definitely does have its place. Transferable peer review. So this is where if a paper is rejected from a journal because it doesn't quite fit the scope or it doesn't fit the aims of that journal, but it's still seen as a good sound paper, the peer review comments can be transferred to another journal so that the paper can be considered in another journal without having to go through the full peer review process again. So the advantages are it speeds up the whole thing. It's very popular with authors because they don't have to wait as long. It keeps research within the publisher, and a lot of publishers do this within their portfolio of journals. It also reduces reviewer fatigue. I think we have a lot of cases where reviewers have reviewed the same paper for another journal, and it can be quite frustrating for them. And as I mentioned at the beginning, there's increasing time pressures on these academics and increasing problems finding peer reviewers. So reducing the work for peer reviews is a good thing. Disadvantages can be frustrating for an author if the paper is rejected again after a transfer, and that does happen. And also the reviewer doesn't get the opportunity to comment on the suitability of the paper for the new journal, and sometimes that is quite important because the context of where it's published makes a difference. So that was my whistle-stop tour of the different models of peer review, and watch this space because I'm sure others will emerge, and all these different alternative methods are being used more and more in publishing. I'm now moving on to my next topic, which is preprints. So I'm just going to talk briefly about this. This was a really hot topic at the ISMPP meetings this year, and certainly seemed to be quite controversial within the room. So I'm just going to give a little bit of background and then give some feedback that we picked up from being in the room at the ISMPP meetings. So first, what is a preprint? So in an academic publishing setting, a preprint is a version of a scholarly or scientific paper that precedes publication in a peer-reviewed scholarly or scientific journal. So I think the important thing to note with preprints is that they have been around for a long time. In hard sciences, they've been around for ages. bioRxiv, which is the biology server, was established in 2013. So it's not completely new, although the medRxiv, which is coming soon, is the new development within this field. So as I mentioned, papers are not peer-reviewed, but readers are given the opportunity to comment on the preprint. Papers are given a DOI, and it's hosted on Google Scholar, and the preprints can be cited. bioRxiv papers can also be revised after submission, based on new developments or based on comments from readers. And the stats that we were given at ISMPP by the bioRxiv guys were that 29% of papers are revised, and 60% are published in journals after 2 years. So journals have got different views on preprints, and I think they're constantly evolving. Most journals, it seems, are fine with prior preprint publication. Some actively encourage it, so PLOS ONE actively encourages preprint submission alongside submission to PLOS ONE. Some do discourage, some do still discourage it. At Taylor and Francis, we're fine with it. Another cool aspect of preprints is that they do have an option to submit directly from the bioRxiv server to a journal, which seems to be quite popular. So as I mentioned, medRxiv is coming soon. There's no fixed date around, but it's on the horizon. So medRxiv will be a sister server to bioRxiv, founded by guys from Yale and CHS Laboratory. And we're told that there'll be an advisory board of clinicians, editors, and others associated with medRxiv. So what are the benefits of publishing a preprint and publishing in a preprint server? So the benefit is acceleration of research. As soon as your research is completed and your paper is written, you can host it and make it freely available to everyone straight away. Another key advantage that was discussed at ISMPP is that it could be posted ahead of meetings, so that speakers talking at scientific meetings have got somewhere where they can refer the reader back to, rather than just talking about a future published article that hasn't appeared yet, which seemed popular. It encourages and improves collaboration because people can comment on each other's work and it's all freely available. Increased transparency, makes less publishable outputs available. So there's a view that it could be very useful for null or sound science studies that maybe people struggle to get published elsewhere, but it's important to publish them anyway, to host them anyway, and increased availability of clinical trials. So now I'm just going to touch on a few concerns that were raised in the room at the ISMPP meeting. And this is not an exhaustive list, but just a few things. So the key thing that people were worried about in the room and came up a lot during ISMPP was the risk to the harm of the public to distributing information that has not been peer-reviewed and could be incorrect. And obviously in a medical space, this is more of a risk. So there may be a risk of publishing something that is interpreted by a clinician as being correct and peer-reviewed, and that being used to inform clinical decisions, which obviously is a huge risk. Manipulation of servers for commercial interest is a concern. There was a concern raised that journals historically maybe don't consider articles for publication if they've been hosted previously as a preprint, although as I mentioned, most journals seem now to be fine with it. Risk of flooding the literature with incorrect or biased information. There was a perception of limited curation. Some concerns that medRxiv hadn't reached out and consulted pharma on their new preprint server. And there's potential for compliance problems and the risk of off-label promotion. So I think it's only fair to include medRxiv's response to some of these potential risks. So the two big things that they respond with is that there are clear disclaimers throughout the whole medRxiv, making it very clear that these papers are not peer-reviewed. And there will be a process for screening of all content by qualified professionals to make sure that we're not putting the public at risk of anything, and also a number of other criteria that medRxiv list as being needed before publication, so they're listed there. Big ones are that they have to be an academic or professional affiliations. They need to have conflict of interest statements. And the big one, no reports that put health of the public at risk. So there will be curation and looking out for things like that. I think as a general thought from a publisher's perspective, I think there's a place for preprints alongside journals, and it could be viewed that they're beneficial to a journal because it allows papers to be commented on and improved before they do come to the journal. So, in conclusion, peer review is still viewed as the gold standard of accuracy, but new models are emerging, becoming more popular, so it's important to keep up with what's going on there. And preprints for medical publication are coming. medRxiv is on the horizon. But opinion is still split about whether this will be a positive or a negative for medical research and how it will evolve once that comes. few links there for further reading, some good resources there which I encourage you to read. That's it. Thank you very much.